Hi everyone, this is Dr. Scott Weiss. I'm a non-surgical sport medicine physician and here today to discuss meniscal tears, whether or not to get surgery for those. I'm a non-surgeon, so I always try to keep people out of the OR. The question is, when do you really need to go to the OR? So one of the first things you want to really assess is whether your knee is having mechanical complaints. And one of the most worrisome mechanical complaints is whether your knee actually locks. So it's interesting. In my practice, when I first ask people if your knee locks, a lot of them will say yes. And then I'll kind of push them and I'll say, well, does your knee really get stuck? Because that's what locking means, when your knee gets stuck, when you can't move it. And then when you push them, they'll say, no, it doesn't really lock, it just gets really stiff. So you really want to decipher whether your knee just gets stiff or whether it locks. Your knee may have some clicking in it, and that's a mechanical complaint, and that could be indicative of a meniscal tear. It can also be indicative of osteoarthritis, but that's something to keep in mind. But clicking by itself usually is not nearly as worrisome as locking. So that's one thing you want to really kind of be clear. Did your knee truly lock? And how often does it lock? Does it lock on a daily basis? Does it lock on a monthly basis? And when it does lock, how long does it stay locked? You have to play with it and kind of fiddle with it to free it up. If you do, and if this happens on a regular basis, then probably that's more of a reason to go to the OR. But if you just have a meniscal tear on your MRI and you do have pain, let's say on the inner part or the outer part of your knee, but you have no mechanical complaints, a lot of times those can be treated conservatively. And what I mean by conservative treatment is physical therapy. Sometimes injections can quiet it down, particularly viscosupplementation, which is like a gel injection, which mimics the natural oil in your knee, or hyaluronic acid. And there are many different companies that make those, and they're all relatively similar in their efficacy. Cortisone can also help quiet the knee down. I usually try to avoid cortisone just because cortisone itself can be harmful for the cartilage. And that's usually if you get more than 3 or 4 injections per year per joint. Unlikely to really cause much harm if you get just 1 injection per joint per year. But nonetheless, I still try to avoid cortisone. And also, cortisone I think got a bad reputation because a lot of doctors mix a lot of lidocaine with cortisone. And lidocaine is also toxic for the cartilage in the knee. And really, lidocaine has no therapeutic value to it when you inject it into a joint. It's just purely to give you anesthesia. So I personally very rarely use lidocaine when I do my knee injections because it has no therapeutic value. And I don't see much value in giving people anesthesia for a couple hours. Granted, they'll feel good when they walk out of the office, but then again, it's not really helping your knee joint. So if you do get an injection of cortisone in your knee, you may want to inquire, are you mixing this with lidocaine? And if they are, you may want to inquire, like, is there any therapeutic value in your opinion for the lidocaine? Because in my opinion, there really isn't. So I usually just mix cortisone with normal saline just to spread it around the knee joint. So if you do get meniscal surgery, it's somewhat of a double-edged sword. If you just have a simple flap tear or a tear that cannot be repaired and you are having mechanical complaints, most of the time the surgeon will do what's called a partial meniscectomy, which is essentially just removing the tear or removing part of the meniscus, trying to trim it and create a nice little stable rim, so hopefully it won't tear any further. So the advantage of that is that it will hopefully get rid of your mechanical complaints, any clicking or locking or catching in the knee. And again, if you are having true locking, then I think you do need this surgery. But the disadvantage of this is that you are basically left with a smaller meniscus after the surgery. And the menisci, they are essentially horseshoe kind of rings of cartilage in the knee between the femur and the tibia, and they kind of shock absorb, they stabilize the knee. And when you do a partial meniscectomy, you're left with less of a horseshoe, essentially. So you're kind of fast-forwarding arthritis to a degree, which is unavoidable when you get a partial meniscectomy. And hopefully, again, the benefits outweigh the minuses. But if you just have a meniscal tear that's a little uncomfortable, but you have no mechanical complaints, and it's not what's called a root tear, meaning the menisci, they are horseshoe kind of rings of cartilage attached to the bone, and they're attached to the bone or the tibia via these ligaments, what we call a root. They're like root attachments. So the roots are attached to the tibial plateau. If those root attachments tear, then the menisci essentially are not free floating completely, but they're not really functioning normally. They're getting squeezed out of the joint every time there's pressure on them. So if you have a root attachment tear, the best thing is to get those repaired, but unfortunately many surgeons don't do that because it's a very involved procedure, and perhaps they feel that it's just not worth it, and that's their call. I mean, again, I'm not a surgeon, so they know better than me, but in my opinion, I guess it's always best to try to restore the anatomy the way it was prior to your injury. So if you have a root attachment tear, best to try to get those repaired if you can, particularly if you're younger, let's say under 40 years old or so. So that is kind of some of the questions I think you need to kind of ask your orthopedic surgeon about meniscal tears. If you just have what's called a degenerative meniscal tear, where it's a horizontal meniscal tear or like a split tear in the meniscus, and you're not having any mechanical complaints, I personally think you should treat it conservatively. Try some physical therapy, try some of those injections like we talked about, whether it's visco supplementation or a gel shot or cortisone. And even there are some newer injections, not so new, but more biologic injections such as platelet-rich plasma, where you take blood and you concentrate platelets and you inject that into the knee joint. That may help quiet down some inflammation in the knee and may help you feel better from your meniscal tear. And they even have stem cell injections where you take fat or bone marrow and you inject that into the joint. I'm not aware of any studies showing that it actually heals your meniscus, but certainly can help control inflammation and pain. So there are plenty of things you can do to try to quiet down meniscal tears. And the reason why I say this is because I think overall, I think that this surgery is a little bit overdone in this country. And I think that many people just need to give it time to heal conservatively, or not necessarily heal, but feel better conservatively. And then you can avoid getting surgery, and hopefully that will avoid getting premature osteoarthritis in the knee, because again, partial meniscectomies, particularly if they take out a larger percentage of the meniscus, can fast forward arthritis and cause premature arthritis in the knee. And then unfortunately some people, a couple of years down the line, they have severe arthritis in the compartment of the knee where they had a meniscectomy, and then they're looking at a knee replacement. So in my opinion, it's always best to try to keep what you got. There are plenty of therapeutics out there today that can help control inflammation, whether it's injection therapy, even medications such as oral anti-inflammatories can be helpful. I'm a big fan of alternative medications such as, or supplements like fish oil and turmeric. I think those are great for inflammation. They could make you bleed more, so you got to stop those a week before any injection or surgery and talk to your doctor before starting them. But there's plenty of supplements out there that can control inflammation. And if you can control the inflammation around a meniscal tear, particularly those that are not causing mechanical complaints, then a lot of times your symptoms can go away and you'll be fine without any intervention. So I hope this was helpful. This is Dr. Scott Weiss, just letting you know from Probe Sports Medicine, located in West Hempstead, New York, and also a office in Boynton Beach, Florida, kind of spread out here. So any questions, you can reach out to me. My email actually is scottadamweiss@gmail.com, SCOTT, Adam, ADAMWEISS @gmail.com. Be happy to answer any questions you may have regarding meniscal tears or sports medicine in general. And looking forward to hearing back from you, and looking forward to giving over the next tutorial. Thanks a lot.